Hello. Welcome to Rock Creek Therapy's workshop. I think I need therapy. Now what? This is a workshop about preparing for therapy. I'm going to break it up into two parts. One is about how to find a therapist based on your needs and uh, maybe even your past experience with therapy, what you liked, what you didn't like. If you've never been in therapy, this is also a great starting place. Um, who am I? My name's Erin Hencke. As you can tell by the letters after my name, I am a licensed clinical professional counselor. I am licensed in Maryland, DC, Virginia, and for telehealth in Florida. And I'm one of the practitioners here at Rock Creek Therapy. My aim for today is to answer some questions that you may not also even be aware of you have when you're thinking about looking for a therapist or when you are looking for a therapist. All right. Okay. So, as you can tell from the slides here, today we're going to talk a little bit about understanding insurance networks and considerations for choosing in-network versus out-of-network therapists. We're going to talk about different therapeutic approaches. Some words that you may be familiar with or you've even had maybe direct experience with is a therapist who uses orientation of psychodynamic, cognitive behavioral, internal family systems, EMDR, and really and also helping you based on getting a better understanding of these different theoretical orientations, what might align with you from a personality perspective and also for your therapeutic needs. We're also going to explore different therapy formats, including individual, group, couples therapy, family therapy, I'll touch on very briefly, and determining which may be the best fit for you, strategies for finding a therapist, and questions to ask during an initial consult. That will be the bulk of this workshop. And then in a part two, I'm going to talk a little bit about therapeutic boundaries. Okay, so to start off, what we're going to do is talk a little bit about the difference between an in-network provider versus an out-of-network provider. So as you can see on the slide, in-network means you're receiving services, you as the client. Also, side note, I'm going to use the term client, but some therapists use the word patient. Again, it does kind of go back to your therapeutic approach or theoretical orientation. I use client most frequently. So in networks means you as the client are receiving services from a provider or a practice that has a contract with your particular insurance company. So if you receive covered services from this in-network provider, it depends, but generally you'll need to pay your deductible and any applicable copays or coinsurances. This is really dependent on the contract that the insurance company has with the provider or the practice, and so it's highly variable. Out of network, which is what Rock Creek Therapy is, and what I'm going to spend a little bit more time with, means that you're receiving services from a provider or a practice, and we don't have any contract or we really don't engage with insurance providers. Insurance companies. So if you received covered services from an out-of-network provider, the insurance company is only going to pay part or sometimes none of the charges depending upon your policy. So you might be asking yourself, why would I go with an out-of-network provider then? And so I'm going to give you the perspective of someone who has been on both sides of it. And I'm really going to focus a little more on out-of-network because there's probably less information from a consumer or your perspective on why we as therapists are out of network. So therapists have different priorities on where we want to focus, and not all insurance companies support that, unfortunately. Many insurance companies want us to primarily use specific theoretical orientations, and many of us don't necessarily agree or see that as lasting change. So I'll tell clients that it's useful, but in my experience, So what I mean by this is I'll tell clients that some theoretical orientations that insurance companies prefer we use is useful, and I'll even use that in my own experience or in my own practice. I'm specifically talking about, for example, cognitive behavioral therapy. And so that therapy can be very useful, but I personally think it is a more short-term, um, it's a more short-term uh, theoretical orientation, or it can have short-term benefits. But for lasting change, we really need to look at the emotional part, the historical significance of the client's history, and many insurance companies are just not going to give us the time that we need, and they don't support all theoretical orientations. So when I'm using terms like theoretical orientations, what I'm talking about is your provider mainly cognitive behavioral? Is your provider mainly psychodynamic? I'll go into like what that means, but we as practitioners, unfortunately, many times have different opinions on what is actually going to lead to lasting change than many insurance companies. Um, the other part of it is many healthcare companies or insurance companies undervalue our services as therapists, which is different than other healthcare providers. The other thing that to consider of why a practitioner may be out of network is our profession involves a lot of yearly continuing education, and that's mainly self-funded. We also, of course, have other administrative duties, such as collaborating with a client's medication provider, past therapists, with each other, especially if we're having a hard time understanding what might be best for this particular client. And then, of course, there's notes and invoicing and all the administrative fees that insurance companies also are not reimbursing us for. And so it can, I say all this to say that our session fee as an out of network provider includes not only FaceTime with you, but all the time needed to prepare to give you the care and consideration for the session. I always, on phone consults, which I'll go into on a later slide, I always encourage clients to, or potential clients to call their insurance company and ask these questions that I have here on the screen, because many people assume their plans don't include out of network benefits, but you actually may be surprised how much you can be applied to a deductible, what they might even pay up front, and then what the reimbursement would be, after even that deductible is paid out. So these are questions that I think are important to get a good sense of what is going to be the financial investment that you're making into therapy. And I'm not going to spend too much time on that, but out of network providers do acknowledge that there is a financial investment, but that can also be really important for ensuring that there is commitment to the process. That I shouldn't say ensuring, but that can be part of the process, in that when you understand the investment it's taking, can, just in my own experience, it can really help drive the engagement as well in the therapeutic process. Now, this is not to say this is standard and with everyone, but one of the differences I have noticed being in network versus out of network is because there tends to be more of a financial investment, there also tends to be a higher level of commitment. Generally, I'm not saying this is for everyone. So this might lead you to the question of, okay, I get the difference between in network and out of network. If you are thinking about, okay, so let's say I'm going to go out of network because this is, I want to work with somebody, for example, who is going to really look at my history and take the totality of my experiences into consideration. And we'll go into what those therapies look like. Another really important thing for you as a consumer, for you as somebody who is looking to find a therapist, is understanding that therapeutic rapport is one of the most important parts of the success of the therapy. So, what I mean by that is that no matter what the therapist's theoretical orientation, all effective psychotherapists need to cultivate therapeutic rapport with their clients. And to the out of network or financial investment of therapy, at the end of the day, the research shows that the therapeutic fit between the client and the therapist is the number one indicator in client subjective experience of success. And that's really why we're here today. It's to help you find and really think about what is the type of therapist I want to be working with. So to that point, what should I be looking at? And one of the things is therapeutic rapport. So that means what I'm saying when I say that is it's the relationship between the therapist and the client that is defined by caring and supportive non-judgmental behavior embedded in a safe environment. So why is that important? Well, one of the reasons it's important is because it allows the client to disclose painful memories or information. I mean, I understand, we all know that therapy is confidential, but if you don't feel that you're in somewhat of a non-judgmental space, the likelihood that you're going to disclose some really painful or maybe even shameful memories or experiences you had is pretty low if you feel that you're in a judgmental environment. It also is really important to facilitate discussing emotions and experiences. A supportive, non-judgmental relationship is important to work through difficult issues and gain insight. And as well, it's important to feel safe and supported as you work through this process and have what we call a corrective experience. So a corrective experience within therapy is, for an example of that would be if you're discussing a time where you were traumatized, to have a person such as a therapist who can witness and be there and hold space for you to feel safe, you can now re-experience or correct that painful experience in the therapeutic relationship and be able to translate that from the therapeutic session or the therapy session to the outside world. Now, that doesn't mean that you're going to be able to translate that to everyone or in every experience, but it starts to give you the practice of, if I can feel safe and comfortable talking about these really difficult, painful experiences with a therapist, and they can see me and they can hold space, and this is true for no matter what the theoretical orientation is, what would it be like to translate that outside of therapy? Who are those people I can have those experiences with? And what made it different having that experience with a therapist versus translating it to outside? As in, what are still the barriers I might be having? But the first step in looking at the barriers is, what does it feel like to be in session and to allow a therapist to witness and hold these really difficult emotional experiences? And when I say hold, witness and see, and not be necessarily overcome by that in the exact same way you as the client were. It allows for safety. So I want to take this moment to also say, what is the difference between a psychotherapist and a coach? Psychotherapy focuses on addressing mental health issues, emotional difficulties, and past traumas. And you're going to be guided by a licensed professional, such as a professional counselor like myself, a social worker, which we also have at Rock Creek Therapy, and psychologists. Again, we do have we do have a psychologist here at Rock Creek Therapy currently. It's more insight oriented, meaning how the past impacts the present. And these professionals are highly regulated by needing a license that to fully gain takes 2 to 3 years at least. And it's dependent on hours. So we're not looking at a time frame, but like to be an independently, what that means and what I am is to have X amount of hours under supervision of someone else. It can take years to get. We also, as I mentioned earlier in the out of network discussion, we have education requirements to make sure that we're getting the training we need every single year to be up to date on ethical standards, evidence-based practices, what essentially the research has been showing has been helpful for our clients because it constantly is changing. So I personally love that I have a continuing education requirement for my license. And I'm glad that everybody does. And as I kind of mentioned with the amount of hours we need to be fully licensed, extensive experience. So that's one way that a therapist is going to be different from a coach. Coaching is more solution focused. It can be more focused on advice giving, and it's not regulated by a licensing board like a state's Department of Health, like therapists are. So when I say I'm licensed in Maryland, Virginia, Florida, and DC, that means the Department of Health in each one of those states has given me a license. So each time I've had to submit all my documentation saying that I've had the training to to offer therapeutic services to clients. Now, that doesn't mean that coaches don't have certifications or there aren't really important spaces where coaches are needed. Um, but coaching is more focused on achieving specific goals, improving performance, and enhancing personal or professional development. So while therapy delves more into the past and present to heal, coaching tends to focus more on the future and without really a consideration of possibly the past or like in depth or even what's going on presently. And so it's more future focused to facilitate growth and change by focusing on specific actions the client can commit to, which is again different than therapy, which is more process oriented and also more insight oriented and also considers the history of the client more so. Okay. So one other thing I just want to mention that is also important for when you're thinking about the therapist that you want to find. Specialization is also a part of this and fit. So when you're looking for a therapist and you're thinking about what exactly do I want to get out of therapy, that's when you start to look at the specialization of the therapist. So for example, if you're somebody who recognizes that you've had a lot of trauma or stressful experiences in your life, you want to look for somebody who the main population they work with are people on the trauma spectrum. If you're looking for somebody who you can explore identity or meaning, existential therapists are a great fit. If you want to find or look at, these relationships and these themes keep coming up in my life, and I'm really confused. What is happening? Psychodynamic therapy can be really helpful. And if you're noticing a lot of intense emotional dysregulation, if you are finding that you're having a really difficult time maintaining lasting quality relationships, if there's a lot of impulse control issues, or if you're, struggling possibly with self-injurious behavior, that tends to be dialectical behavioral therapy can be really helpful with that. And we'll go into it. Many therapists use multiple theoretical orientations. I'm one. Multiple therapists at Rock Creek Therapy use different modalities, and not modalities, orientations. And it really, in my experience, is dependent on what the client needs and what aligns even more so with my personality as well. So going into that, fit is also part of what we're talking about here. It's not just, the population that the therapist sees, but it's also important to get a feel for their personality. There's all types of therapists and there's all types of clients. And some therapists are more direct. That does not mean that they don't have a non-judgmental or caring attitude like we talked about in therapeutic rapport earlier, but they might be just more blunt and to the point. There are some therapists who are much more empathetic and person-centered, and there are therapists who may use more humor, may use more symbolism, metaphor. It really depends on their personality, and that's something you can kind of also get a better feel for when you're doing the phone consult. Okay, so now we're going to talk a little bit about what I've been mentioning throughout and therapeutic theoretical orientations. I'm going to say this is going to take a little bit more time. There's a lot we have to go through, but I'm going to give you a brief synopsis of what each one of these theoretical orientations mean. And I'm also, a lot of my colleagues were nice enough to offer me a blurb of like why they use some of these. So you can get a direct sort of narrative from some of the Rock Creek Therapy therapists about why they use it. So as therapists, we all hold or psychotherapists, we hold a master's level or above degree. And so part of our therapeutic training in grad school includes exposure to different theoretical orientations. This is really just another way to say, what is our perspective and what is our roadmap and how does it align with us, and how does it explain the client's presenting problems, and also, even more specifically, how does it dictate treatment? So this is kind of like our roadmap for how we conceptualize or look at issues, symptoms, progress, and treatment, and the goals. So like I said, usually we might focus on a few of them. There are a few therapists who are strictly cognitive behavioral, or strictly DBT, or strictly psychodynamic. But for me, I find that pulling some different perspectives or theoretical orientations, or interventions, can be really useful because people are complex and they have different stories and they have different histories. And sometimes an existential approach will actually be really helpful for where my client is in their life. Sometimes DBT can be really helpful because I have a client who is struggling with relationships and self-injurious behavior. Sometimes, I do a lot of trauma-based work, which is mainly internal family systems. We also have practitioners at Rock Creek Therapy who are licensed and trained in EMDR, and that can be really effective for processing developmental or incident-based trauma. Developmental means there's multiple times throughout your development that you experience trauma. An incident could be like one traumatic experience. So let's start with probably the most popular. I would say it's the one that most practitioners have had the most training in grad school. That might be a generalization depending on the program you went to, but this is the one that I personally was given a lot of training in. And I do use it. It's just not what I would identify as my main theoretical orientation. So cognitive behavioral, CBT, is present focused versus historical based. Psychodynamic is more historical based. And It's an approach that believes psychological problems are based on faulty or unhelpful ways of thinking. So, cognitions is another way to say of thoughts or thinking patterns, and on learned patterns of unhelpful behavior. So, like, this is where the name comes from. It's looking at the tie between thoughts and behaviors, or behaviors and thoughts. It's bidirectional, it goes both ways. Um, and it can be very effective. Some people really have benefited from cognitive behavioral therapy. There's a reason it became, I would say, the gold standard with a lot of insurance companies and medical providers. It can be really effective for anxiety based disorders, especially something like OCD, obsessive compulsive behavior. Um, but in my opinion, I think generally it's better in the short term or for very specific goals dealing with behavior. But I think for lasting change, other modalities can be more effective. Now, when I say lasting change, that also means it takes longer to process and really heal, I guess you could say, from what brings you into therapy. But it's effective, definitely with certain presenting problems. So the next one you might have heard of is ACT. This stands for Acceptance Commitment Therapy. And this emphasizes this emphasizes acceptance to deal with negative thoughts, feelings, symptoms, or circumstances. ACT therapy encourages increased commitment to healthy, constructive activities that uphold your values or goals. So ACT is really going to also explore what are the values that you have, what is the difference between your ideal values and how you're living today, what is that bridge, as in what's needed to start living within your values, and how can we have a little bit of space or emotional distance from negative thoughts or feelings or even the symptoms we're experiencing. So it's looking kind of at what I might call the meta emotions, like how do you feel about that? And ACT really looks at like how can we have a little bit of distance from it, and what are the behaviors that you need to change to live a life more in line with your values. So it is also kind of in the umbrella of cognitive behavioral therapy, as well as the next one I'm going to talk about. It's also in the sort of cognitive behavioral therapy umbrella, which is DBT, which stands for dialectical behavior therapy. It's commonly used for people who experience emotions very intensely. It began in a group format, and it's commonly associated with people who have been diagnosed with a personality disorder. That's what it's been associated with. However, it's widely applicable. It's really great for looking at what are the boundaries. Like boundary work is incorporated, I would say, a lot into DBT. The main four pillars it's focused on is mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. DBT is also fabulous because it has it has a lot of exercises that you as the client can do outside of therapy. It can help you with trying to figure out how to talk about your emotional needs, what you're looking for in relationships, really great communication strategies. And like I said, it also focuses on mindfulness. Dialectical looks at how two paradoxical ideas can be present at the same time. And so how do we have acceptance and tolerance, the distress tolerance part of it? How can we tolerate two opposite emotions at the same time, or opposite ideas? So you can see why it's popular. So that's sort of one part, or one sort of branch of theoretical orientations, looking at thoughts, looking at behaviors. CBT, ACT, and DBT are all in that realm. The other approach that I think is important, not I think it's popular, and for a reason, is psychodynamic therapy. This is a form of psychotherapy that explores how unconscious thoughts and past experiences influence current behavior. How it's influencing your past is essentially influencing your behavior, your emotions, and your relationships. It aims to bring these unconscious factors into conscious awareness to help individuals gain insight into their inner conflicts and make positive changes in their life. So it is more insight based versus, psychodynamic isn't known for doing a lot of behavioral exercises in session. That might be something associated with the CBT umbrella. Psychodynamic is out, a an offshoot, I guess you could say, of psychoanalysis, which is what Freud was known for. It is different than psychoanalysis. I want to be very clear about that. But it does look at essentially like the unconscious and historical uh, experiences in your life and how they are impacting or in the here and now. So many of my colleagues, including myself, take this approach, or this is one of the approaches I take. And what some of my colleagues have said about why they like it is it's about exploring past experiences and relationships and how that can be useful in processing things in the present. It's a deeper dive into the client's history where together we will explore how their past experiences inform their present. And this approach helps clients understand essentially why they are the way they are and how their struggles and past experiences influence this. So, moving on to emotion focused therapy. This is a type of psychotherapy that focuses on helping individuals recognize, understand, and regulate their emotions to improve overall psychological well being. It emphasizes emotions in a healthy way to facilitate personal growth and healing. So, one of my colleagues who does identify or and practice emotion focused therapy stated that they like it because it helps clients deal with things in real time rather than just telling me about what happened this past week. It can be helpful to start with an update, but then we check in with the here and now, what you're thinking and how you're feeling in the present moment. That's when the brain is most malleable and we can help you make the longer term changes you want. Of course, that can make things feel more vivid, and that's hard for a lot of people. So we can do it slowly and manageably so you feel more like you're doing therapy than therapy doing you. Another important theoretical orientation or popular one is relational therapy. And this one is integrative in that it takes from a few different theoretical orientations, and it takes from cognitive behavioral, psychoanalytic, and psychodynamic principles and applies these principles to your daily interactions with others. Many of the techniques used in this approach use the therapeutic relationship as a tool or mirror for examining relationship dynamics in the client's life. So another thing to know about relational therapists is they will use the therapeutic relationship as a tool to look at what is happening between the client and the therapist and how is that dynamic also playing out outside of the therapy session. So again, if like a really important theme I think in all of, well, not all, but many of the therapies that I'm talking about is how what's happening in the therapeutic relationship in the room in the session is a microcosm or a smaller version that symbolizes things going outside of therapy. And I think that's when therapy really works best, is when we can see what is happening in session or what you're talking about in session. And with the relational therapist, including what's happening between you and the therapist, and how can we apply that to your relationships outside of the session, including with yourself. Okay, so I'm going to talk a little bit now about um, trauma-based therapies. This is especially recently become quite popular. There's a lot of research that has been put into trauma-based therapies, as well as that's where a lot of the research today is. So trauma-based therapies include EMDR, which stands for eye movement desensitization and reprocessing. So it actually has to do with using your eyes and eye movement to reprocess difficult experiences you had. We're also going to talk about IFS, which stands for internal family systems, which I personally love, and somatic experiencing. So, EMDR, it's a structured therapy that encourages the patient to focus briefly on the trauma memory while simultaneously experiencing bilateral, meaning both hemispheres of the brain, stimulation, which are typically done with eye movements. And it's associated, the reason they do it is with a reduction in the vividness and the emotion associated with the traumatic memories. So it gives you a little bit more distance where you're not so overcome by the pain of that trauma memory. So when we're talking about trauma memories, this is when we're talking about in a post-traumatic stress disorder, when we're having active physical activations. And so this can help to kind of give us relief from that in the moment. So one of the practitioners at our practice described it as, or why she uses it, is it's based on adaptive information processing. So this type of model or therapy is based on the theory that we have experiences in life that we are not able to handle adaptively or healthfully. And these maladaptive, unhealthy responses get stuck in the brain so that when we have similar experiences in present day life, we respond in maladaptive ways. So when we're reminded of it, but we're having that experience in the present day, we can react in unhealthy ways. So we need to reprocess these experiences in order to respond more healthfully. And that's what EMDR hopefully does, or that's what the model is based on. Internal family systems, it's based on the notion that every human being is a system of protected and wounded inner parts, which is led by a core self. So that's a lot, right? But essentially what internal family systems posits is we have a core self with a capital S that is not traumatized, that everybody has this, that another way to think of it is our essence. It's when we feel grounded, when we feel like we're in a flow, when we feel confident, compassionate, clear, creative. There's a lot of different ways we know that we're in this self core space. And when it's based on the idea that there's multiple parts of us, that, and there are parts of us that have been created throughout our life due to stressful or traumatic experiences that we couldn't deal with in the moment. And so we have these protectors. We created these protectors to take care of us and to help us through difficult situations. And they still exist within us. And we can access them when we're going through a difficult time. And when it's important to really examine what change needs to happen is when these protectors are getting in the way of living a life that we would like. And so that type of therapy utilizes different techniques to dialogue with those parts of us, and figure out why they're coming up and what is the need that we actually have in that moment. So I really like it, obviously. So next we have, and the last part of this probably lengthy slide, is somatic experiencing. So this is a body-focused psychotherapy that's based on the concept that when humans experience trauma, they can become trapped in the freeze part of the fight, flight, or freeze response. Peter Levine, the creator of this therapy, explains that we remain frozen in many parts of life as a reaction to a traumatic experience. These frozen parts of ourselves accumulate energy as they should, but expand it in ways that are counterproductive to a healthy life, such as through stress and anxiety. So they believe that frozen parts of us start reacting as a response, and as it gets personified through stress and anxiety. So the goal of somatic experiencing is to redirect this energy in healthier directions. But it's definitely a more body-focused one. This is one that some people find very attractive and are really interested in, because it is not as much focusing on thoughts or emotions. It is purely with what is happening in your body and how do we redirect that. All right. And not lastly, but one of the final slides that I'm going to talk about in this part is regarding therapeutic modalities. So when I say this, I mean, are you looking for individual? Are you looking for group? Are you looking for couples? Or do you need a family systems approach? As in like more than, a couple, or is this a mother-daughter or a father-son or something along those lines, as far as like who are the people who are coming in to therapy? So I think individual is pretty self-explanatory. Group can be helpful. Like, why would you want to go into a group is kind of what I want to talk about for a moment. Is group can be helpful and validating to hear similar experiences and voices from your group members that all identify with the group topic or theme. So groups can be open, which means clients can join at any point. They can be closed, which means they can only join at the beginning of the group, and at the same time as other group members. It's usually time limited when it's a closed group, and can be psychotherapy based or more skills based. So it can be more about processing, or it can be, I want to learn how to communicate better, right? It can be very driven by behaviors or learning a behavioral skill. One thing about group that is nice is it's usually more affordable than individual therapy. They can be long-term. So sometimes we'll have group members who are in groups for years, mainly because it can be really helpful for them as they're going through different transitions in their lives, or they are, it's helpful for them to have other people who know them and who can help them work through, this sounds like this other part of your time in your life. And it can be really powerful to stick with, different group members throughout different phases of life. The group facilitator will go over the boundaries of the group and should be screening you or interviewing you to make sure you're a good fit for the group before starting. So expect, if you're going to start with a group, that there's going to be some individual assessment, anywhere from 1 to 3 sessions before the group. And it's to make sure that you are a good fit, and also that this group is a good fit for you as well. This is also really helpful for somebody who is intimidated by individual therapy, or if you're noticing that there's a lot of common themes with your relationships. It can be really helpful outside of even individual therapy to get feedback from other group members who are dealing with similar issues. All right. So another thing I'd like to briefly talk about is how exactly you go about connecting with a therapist. A great tool is to ask your family and friends if they have a good experience with a therapist. Now, I know this may be hard for some people because they're not ready to talk about that they're looking for therapy or that they want to go into therapy. Sometimes people can be nosy and say, why do you want to go into therapy? But word of mouth can be really powerful, and it can also be a great place to start, um, especially if you have somebody in your life who you've seen a change in, and being curious about, if they're open to talking about their experience with therapy or their experience with a therapist. Um, Referrals from friends and family can actually be really useful when you're looking for somebody you trust and somebody who's high quality. Um, Google searches are a common one, especially if you want in-person treatment. Therapy is really important, or can be really successful when, as I mentioned earlier, there's a commitment. We at Rock Creek Therapy believe that weekly sessions tend to lead to the longest lasting changes, and we actually require it at the beginning. Um, and so being able to find somebody who is going to be convenient is actually really important, because we want you to be able to easily access us. And virtual has really made it, um, it's really opened doors for who you can find as a therapist, especially with specialization. But if you want in person, which many people do, finding someone locally is really important, or close to work, if you want somebody that you can go see before you start work or at lunchtime. Psychology Today is another common one. What I definitely recommend is, if you're going on Psychology Today, use filters. Be specific about what you're looking for, because as I mentioned earlier, and we'll kind of talk about on the phone call, specialization and personality or fit is really important. So look at the videos they have, read their bio, get a sense of, you'll get a sense of who they are just from those small snippets, but the phone consult is also really important here. Um, Something to know about when you're looking for a therapist is, as somebody who is licensed in multiple states, I can only see somebody virtually if they are physically located in the state that I am licensed. So that is because the licensing boards want to make sure that if we're treating somebody and there's an emergency, we are informed about the appropriate emergency response, and those numbers and who we need to call if there is actually an emergency. I don't know if you're in, Southern California and I'm out here in DC. Which I'm not, if I'm not licensed in California, I don't know what the numbers are for that area to call if you happen to say you have, some thoughts that are dangerous to you or another person. And not only just thoughts, but actually seriously considering it. So just know, when you're looking for a therapist, wherever you're going to be taking the session, that therapist has to be licensed where you are physically going to be. And the last part of this workshop that I'm going to talk about briefly is the phone consult. So these, I have worked in practices where they did not offer this, and I have to say, I think it really is a game changer, as far as, even though it's only 15 to 20 minutes and most therapists will offer it free of charge, it really can help both the therapist and you as the consumer looking for a therapist to make an informed decision. So on that phone consult, you'll get a sense of personality. You'll get a sense, it's important to understand the specialization of the therapist, but please be aware, it is not a therapy session. So I know that might be, I don't want to say confusing, I might be assuming here, but it is not the time where you're telling me about really serious traumas you've had in your life. I might ask, what you're looking for in therapy, what some of your general goals are or what is even bringing you to this phone call today, but it's not a space to start talking about the very specific things you want or that have impacted your decision. 2 reasons. One, it's 15 to 20 minutes. And second, there's, we're not under limits of confidentiality at that point. So I also want to just kind of encourage you that, like, understand until there's, an intake session, that it's not therapy. And so you want to be not careful about what you say, but just be aware. It's also a space for research. We're not starting the therapeutic process yet because you don't know if you want to work with me or whoever you're on the phone consult with. So what I always say is do a few of them. Try to interview a few people. And then after you've asked all the questions that you think are important to make your decision, go with your gut. Some questions that my colleagues have said have been really helpful on their phone consults and that I find have also been helpful is to ask the therapist, describe how you can help me. What does a therapy session look like? I think that's a fabulous question whenever somebody asks me that on a phone consult, and I might offer that to them if I know that they've never been in therapy before. Another question is, if this applies to you, I have been in therapy before, but how do you think this will be different? Asking the therapist, are you in supervision or consultation? Here at Rock Creek Therapy, it's mandatory and not I think that's, again, with the continuing education piece, it's really important for therapists to be in their own supervision or consultation, which means you're thinking about, you're running certain cases past another person. You're getting feedback. You're hearing from other people how they're conceptualizing their cases. Again, it's done anonymously. We're not giving specific details, but this is also included in our informed consent. So you are aware of that. And then asking the therapist, have you ever been in therapy? Fair question. I would want, if I am in therapy with somebody, to know that they've been on my side of things. Another question I thought was great is, how much do I talk versus listen? And this might be especially important if you have an issue that other people in your life have noticed, such as if you've gotten feedback that you are taking a large portion of the conversation, it might be important to look at why. Or if you're really quiet all the time, that might also be important to look at therapeutically. And also, there are some therapists who are more directive and more comfortable with silence, and some therapists who are going to be asking you to talk the majority of the session. Again, lots of different therapists, lots of different clients, but it's an important part, I think it's an important question to ask the therapist. What's your approach? Another way to say, what's your theoretical orientation? Do you have experience treating clients like me? We're looking at specialization there. What would you do if I was stuck or didn't want to talk about something? All helpful to get an idea of personality fit. So that is a lot of information I know I threw at you about what it's like leading up to engaging with a therapist. So I hope you enjoyed this and have a great day. If you'd like to find out more about therapy, you can visit us at rockcreektherapy.com. You can also call us at 202-630-8120, or you can email us at hello@rockcreektherapy.com. If you'd like to set up an initial 15-minute consultation session with any of our available therapists, please feel free to reach out via email or phone. Thanks so much.